Good morning. Greetings to the participants of the 47th annual meeting of EAMDA. It is my pleasure and privilege to be this morning with you and share in these following 15 minutes some of the remarks of accomplishments of Muscular Dystrophy Association of Slovenia. In 1997, Boris Šušević, at that time president of the Muscular Dystrophy Association of Slovenia, on his initiative, we had a meeting with, at that time, docent Janez Faganel, who was the director of the unit for neuromuscular disorders of Institute of Clinical Neurophysiology, myself, and as always, Boris arrived to the meeting with a big package of documents to discuss how we can facilitate, how we can improve collaboration between science and clinical practice. He provided to us the evidences how all significant accomplishments has been initiated with clinical practice and science. However, he pointed out that was always between bigger or smaller gap, and he was asking to discuss how we can shorten this and narrow this gap. The conclusion of this meeting was to initiate the organization of one meeting which will discuss how to restore the neurological function of progressive neuromuscular diseases. And at the end of this meeting was a question, is it not a paradox to talk about restoration of progressive disease? However, on the end of discussion, we have found that actually the life is a kind of a progressive disease, and we are not short of our wishes to develop restoration and prolongation of life. But we are not going to do the same this time for neuromuscular disorders. Now let me define what is restorative neurology. It is a branch of neurological sciences that applies the active procedure to improve the impaired nervous system functions to modify according to the underlying mechanism of their functions. What is different between restorative neurology and clinical practice? It is that we are trying to understand the underlying mechanisms of deficit which we are finding as a physician about the functions in the integral, which we call movement. Anyhow, it took some time. It took about 34 years, before we succeed to get foundation who funded and organized the meeting on neuromuscular diseases, which was held in October 11-13, 1984 in Houston, Texas. And for this meeting, organizing committee succeeded to recruit the 43 physicians, humans, representing human and basic researchers from Europe, United States, and physicians which have been taking care of patients with the progressive neuromuscular diseases. The result of this meeting was a book which you are seeing in your slide, and together with the sculptures made as an artist representing the 4 different periods in this past 34 years and the hope for what can happen for the next 34 years. At that time, we asked Sir John Walton, who was a professor of neurology from the Newcastle upon the Tyne in the United Kingdom, and pioneer in the field of neuromuscular diseases of classification of neuromuscular disorders. At that time, he was also the first vice president of World Federation for Neurology and chairman of their committee for research. And here, what he said and what he wrote in the foreword of this book. He said that I have taught medical students and young neurologists in training in whom it had been my privilege to teach over a great many years. There are at present in medicine and indeed in neurology many diseases which must be accepted to being incurable, but there are not which are untreatable. Now, I have tried to review for you briefly in the next 10 minutes the headings from this book, the topics which has been presented. Obviously, I cannot do in details, but here is the highlights from this monograph. The first main topic was corrective procedure and principles of management of neuromuscular disorders. For this topic, we had 3 speakers, and I will mention just only one who discussed pathogenesis and treatment of scoliosis in neuromuscular disorders. The next topic was restorative possibility based on motor unit physiology and neurocontrol of posture and gait in neuromuscular disorders. And for this topic, we had 6 speakers. And let me mention only a few of those lectures, and one was about utilization of induced functional changes in progressive neuromuscular diseases. The next one was neurocontrol of upper motor neuron and progressive neuromuscular disorders. The next one, neurocontrol of posture in progressive neuromuscular disorders. And the next one was neurocontrol of gait in progressive neuromuscular disorders. The next topic was dedicated to the pathophysiology of restorative neurology of neuromuscular disorders. And for this topic, we had 5 speakers. And let me mention only some of these lectures. And one was changes of motor units in neuromuscular diseases. The next one, restorative procedures in relation to the pathology of progressive neuromuscular diseases. The next topic was pharmacology and restorative neurology of neuromuscular diseases. And for this topic, we had 2 speakers. And one of them talked about pharmacological approach in the treatment of neuromuscular diseases. The next topic was neurobiology and restorative neurology of neuromuscular disorders. And for this topic, we had 11 speakers. And let me mention a few of these lectures. One was dedicated to molecular genetics, trophic factors, motor neuron development, and synaptogenesis. The next one was devoted to the mapping of genes of muscular dystrophy. The next one was dedicated to the mechanisms regulating synapses reorganization of developing skeletal muscle fibers. And the one more, it was dedicated to effect of electrical stimulation of muscle dystrophic motor neuron activity and phenotype. The next one, sorry, we need to repeat it. And the next one was motor neuron activity and phenotype expression of muscle fibers. Conclusion of this meeting before 60 years ago was that symposium have demonstrated just how many methods and techniques have been available to assist patients suffering from neuromuscular diseases, affliction of their life with components or even in some cases to overcome the major consequences of particular disabilities which illness has produced. When reading the program of your today meeting, we can expect further significant advancement to the treatment. It might be the time that we shall again set up an restorative neurology symposium of assessment of new molecular biological achievements, other neurobiological, neurophysiological, and their safe transition to the clinical practice. Just 2 months ago, the New York Academy of Sciences had organized a meeting on molecular medicine and mechanisms of RNA spliting. SMA is caused by lack of function of SMN protein. SMN1 produces primarily functional full length of SMNA protein. And as I can see from your program, this is what you're going to talk about the next 2 days. And let me finish this presentation by meeting again Boris Shusheshish, who told me not long ago that his entire life has been slow physical decline, race against time. The vision of Boris Kirich was how to develop a demonstration center for clinical practice of restorative neurology of neuromuscular diseases. I do hope that you will be, during the next days, discuss how, if this can be feasible, to put together. Thank you.